Hi everyone, we are back with another video with you. Here is Shannon and welcome to my YouTube channel. I hope you will actually subscribe and hit that notification bell to ensure that whenever I upload a video you're actually notified, and then you'll be able to follow that video and then learn something from it. So today we're actually going to learn about one thing. I don't think it's a topic. I don't think it's a topic. Maybe it is, but somehow it's general. So we're going to look at the nursing care plan, on how to write the nursing care plan. Final NMCZ exam likes those things. I think on our final exam in November we had almost 4 nursing care plans in different courses. Like they're just bringing nursing care plan in peds, nursing care plan in medicine, nursing care plan in surgery, all those things. Of which it's a must as a nursing student or as a registered nursing student, you need to know how to write a nursing care plan. It's not only for your exams, but it's also for the patients you look after in your wards. They need your care, your well planned care. So you need to know how to write a nursing care plan. To begin with, one thing we need to know about the nursing care plan is, in general, to just define it, I'm saying this is just a process of identifying a few problems on the patient. You diagnose those problems. After doing that, you identify the goal and a few things that you're supposed to put in measure in order to attend to that patient's problem, or in order to prevent that problem from occurring. So looking at this topic, or looking at this whole thing, the nursing care plan, we are saying we've got two things involved. We've got the actual problem and then also the potential problem. When we talk of the actual problem, we're actually talking of something that we are seeing with our eyes. If not with our eyes, with all our observations, we're able to tell, to say the patient has this problem. For example, a patient may have fever. That's the actual problem. A patient may have, let me say, maybe may have dehydration. That's the actual problem. A patient may be losing weight on your ward. Maybe they came with 65 kgs and 5 days down the line they are 50 kgs. That's the actual problem. You've even seen to say the problem is actually there. So that is what an actual problem. It's something that is there on the patient. You've seen it, you've observed it. And then coming to the potential problem, we are saying a potential problem, it's something that has not yet occurred, but it has a possibility of occurring if at all we don't put corrective measures as we nurse our patients in the ward setup. So for example of a potential problem that I can give, let me say infection. Someone may come on the wards without an infection, and then because of our carelessness, because we were unable to attend to that patient very well, they end up acquiring nosocomial infections. That's a potential problem. It hasn't yet occurred, but if we don't do our measures very well, a patient may manifest with that. Another thing that we can talk of is injury. If we don't put corrective measures, we don't remove excess furnitures, let me say, maybe especially in people who have mental problems. If we don't remove excess furniture, we may find these patients injuring themselves because of our carelessness. That we were unable to put corrective measures, such as ensuring we provide a safe environment for them. That's a potential problem because it has not yet occurred, but it may occur if we don't put corrective measures. So when you look at a nursing care plan as you draw it, it's just that I don't have something to use as in like an advanced thing where I can be showing all those graphs on my screen, but I hope my explanation will be clear for you and you'll be able to get one or two things. So as you draw a nursing care plan, one thing you need to know is that it has components. The first component that you need to know, in the wards we usually include time. There's a column for time, date. You identify the problem, nursing diagnosis, the goal, you come to interventions, and then evaluations. But when you are writing in an exam, we actually exclude time, we remove dates, we just start from what? From the identifying of the problem. So you have these, let me say, these parameters. You have the first one is you need to identify the problem. After identifying the problem, you need to actually write a nursing diagnosis. You've identified the problem. What has caused that problem? That is what you're supposed to write on the nursing diagnosis. Okay, let me give an example. Let me say someone has got impaired breathing pattern. That's the problem that we've identified, and that's an actual problem. But when it comes to nursing diagnosis, what has caused that impaired breathing pattern? So as we are writing the nursing diagnosis, there are two things that are involved. After writing that problem you've identified, you also need to write what has caused that problem, of which when writing we usually put it as related to. And then after we've notified, or after we've identified what has caused that problem, we need to write the second thing, which is the evidence. You need to put an evidence to show that indeed that problem is actually there. From there we come to, or let me actually give an example on the issue of adding an evidence. Maybe pick a problem: impaired nutrition, related to patient having anorexia, lack of appetite, they're not eating, evidenced by patient losing weight. That's an evidence. Then you are done with your nursing diagnosis. And then coming to the goal. Your goal should be, the time should be You can't say, let me say, impaired breathing pattern, you put goal to improve patient's breathing within 1 hour or within 2 hours. That's wrong. You may think, how did they mark me wrong? That's wrong. How can you let the patient labor with breathing for 2 hours? They may be cyanosed, some other organs may die, vital organs such as the brain, the lungs, the kidneys, they may perish without oxygen if you take your time too long without stabilizing a patient. So when it comes to, you should be sensitive as you are putting goals. It should be something that is well measured, to ensure the well-being, to ensure the safety of the patient. Such as breathing pattern, you can put at least 30 minutes. It shouldn't be more than that. Within those minutes, you should be able to stabilize the patient. You should be able to suction, to give the oxygen, to ensure that the saturations have improved. If the patient was cyanosed, they're supposed to be at least improved. The color should improve. So those are a few things when it comes to time. Then there are things in mental health, such as patients that have got mental condition. Most of the time we find that it's hard to just put it to improve patient's condition within 1 hour, 2 hours. It's usually hard. But with actual problems in mental health, we find that maybe you can put it to improve patient's verbal communication within 1 or 2 days. You can put if it's 1 week, all those things when it comes to setting goals. And then when it comes to implementation, that's something something very easy to do. A nursing care plan, you don't have to master. You don't have to master points. You have to actually know how to manage the patient. If you keep mastering, to improve shan, you keep all those points for yourself, it will be very hard, because they may bring a condition that will not even need that problem that you mastered. So it's actually an issue of having enough knowledge on that condition, having enough knowledge about that patient, the pathophysiology of that condition, the signs and symptoms of that condition that a patient may manifest with, and the actual observations that you've seen with your own eyes. And that will make your nursing care plan easy. So when it comes to implementing, it's just easy. First thing that you're supposed to do on every patient, you have to assess to see the severity of that problem, so that it will help you to act as a baseline data. It will help you to come out with what solutions am I going to put in place after knowing this problem and its extent. So you have to assess the patient. If it's nutrition, if the patient can't eat, you insert an NG tube. That's a point on its own. I'll give meals 2 hourly. That's a point on its own. I'll weigh the patient. That's a point on its own. So it's easy. Any little thing you do for that patient is actually a 1 mark when it comes to intervention. So you shouldn't struggle so much. If you are in an exam room, just leave your mind let me say leave your body in an exam room, but take your mind back to the wards. Think of that patient, imagine you're nursing that patient, and then come up with those points. And then when it comes to rationale, you need to give a reason of why you are doing that thing. So it's nursing interventions stroke rationale. You need to give a reason why you are actually doing why you're actually doing whatever you're doing. Let me say maybe prevention of infection. Say, I wash my hands in order to what? In order to prevent infection. That's a rationale. You need to give a reason. In nursing, if you don't give a reason, it's just like if you don't document, you have not done it. Even sometimes in nursing, you say if you don't give a reason why you are doing that thing, then you don't know what you are doing actually. So that is that. And then the last parameter that we have, it's evaluation. You have to evaluate what after you've carried all those measures you've put in place, you've attended to the patient, you need to evaluate, has the patient improved or not? You have to evaluate, say, okay, maybe say you had set a goal of 30 minutes. After 30 minutes, did the patient improve their breathing? If they did, you're going to evaluate it. Patient has improved what? Their breathing within 30 minutes. And you need to add an evidence as you're evaluating. You need to say evidenced by, if it's a normal breathing or normal respirations of 20 breaths per minute, that's an evidence. So whenever you're writing an evaluation, don't forget to write an evidence. I'm just giving a few examples on the problems identified, the nursing diagnosis, the implementations, how to write them, but you need to get the whole concept on how to write it. Don't master, maybe you may master identification of problems, but it differs with every condition that they give you. Thank you so much. I don't want to say much. I hope you got 1 or 2 things on how to write a nursing care plan. That's not hard. It's actually the best thing that they can ever bring on your final exam or on your final end of year exam. The video was a little bit dark due to its evening. I didn't want to switch on the light because it would have affected my background. So thank you for listening to this video. I hope you've learned 1 or 2 things. Don't forget to subscribe, share the channel, share the video with others, so that when I upload a video, they'll be able to follow it, learn from it, and also you share knowledge. I love you all. Take care, and I wish you all the best in your studies, in your exams. Be a good nurse.